Hi, and welcome to the University of Buffalo's School for Social Work course, Mental Health and Disability Social Work, also known as SW 572. My name is Mike Langlois, LICSW, and I'm a clinical social worker, and I will be your instructor for this class. My contact information is on the syllabus, and you can contact me through my email there, which is malanglo@buffalo.edu. I'll be having office hours on Thursday, 1 to 2 o'clock by appointment. And my hope is that many of you will come to the office hour so that we can have a discussion as part of the class in a general way on the readings that week or any questions you might have. We'll be doing it by video conference, and you can certainly talk with folks at UB about Office UB Ally, how to get started with that. Or we may use Zoom, which is another conference software. More details on that as we get closer to it. Let me describe the course a little bit for you. This is an advanced topics course, and in it we're going to examine the policy theory, research, and practice issues related to mental health disabilities across the lifespan, from birth to death. The course is going to focus on problem definitions, excuse me, and evidence-based service provision in the mental health settings. We're going to utilize trauma-informed practice, human rights perspective, and we're going to find that central to this course is an understanding of both where we've been in terms of historical policy, as well as looking not just across time, but across space in different parts of the nation, region, and local levels. So you're going to get a chance to take a look at policy and how we carry out policy theory and how we put it into practice throughout the course of this course. This course is not a practice course. It is a course that's designed to integrate policy and intervention. So it's really important we keep that in mind as we move forward. There is no required text for this policy. Rather, that we've chosen a number of readings in the form of articles or videos, as multimedia as we could get, and you'll have all of that in your course reserves when you log in. Let's talk a little about the course format. This is an online course, as you've probably noticed, and therefore what we do is, since we don't have a classroom setting each week, we create one through what we call module-based learning format. And what that is basically 3 different modules that are going to have several sections. The first module is going to be focusing on several topics, including the overview of prevention, intervention in mental health, behavioral health parity or equality, ensuring mental health care, mental health disability law, policy and service delivery, public mental health systems, structures and goals and constraints, and the recovery movement, consumers, families, and mental health system, and how all of those work together or don't in terms of the recovery movement. That's module 1. Module 2, we're going to take a look at the prevalence of psychiatric disorders in childhood and adolescence. We're going to take a look at epidemiology of adult disorders, and we're going to look at the epidemiology of mental disorders in older adults, as well as mental health policy and aging. The last section, the last module rather, is going to take a look at child mental health policy, services for adults with mental illness, epidemiology of substance abuse and the treatment system of alcohol and drug dependence, and mental health issues in the criminal justice system. So as we move through the course, we're going to move through all of these modules and sections, and we are going to have several opportunities for dialogue in terms of discussions, which I'll get to in a second. In terms of the course, one way it is similar to classrooms is that if you do have anything that makes it difficult for you to access the curriculum due to a disability, either physical, mental, visible or invisible, it's really important that you let us know. You need to let us know at the beginning of the class so that we can support you, not midway through or at the end. We can't do retroactive accommodations for a disability. We need to make sure that we give you what you need right away. So if you know that you have an identified disability, you can feel free to let me know by email, and I will certainly help you get the accommodations you need. In terms of course requirements, we're not going to grade you on participation, although I will let you know that UB Learns does track how much time you're spending in the system. I won't be looking at that with an eye to grade, obviously. I think that's actually a little creepy, but it is the way it is. What I do want you to do is make sure that you engage with each other in discussions and engage with me in discussion through email, or as we're going to talk in a sec about, the discussion board. When we do these discussions, often we will be talking about cases, and since we're talking about cases, we're going to need to, even though it's a classroom setting, keep HIPAA in mind, which means that basically you need to de-identify any content so that none of us could recognize the person that you're discussing or the case or situation you're discussing. So if you want to share cases, this can be a very enriching form of your education, and I encourage you to do that. Just keep in mind you need to do it in a way that's going to be keeping all of the identifying information out and redacted. So a word about papers. There will be a couple papers in this course. That's probably not a surprise to you. Probably also not a surprise that since this is an advanced topics course, we're expecting you to use APA style. You need to be adhering to APA style all the way, including the fact that papers need to be typed using Times New Roman 12-point font. We're going to be that specific. Part of the reason is because some of you are going to be writing for publication and all of you are learning how to communicate. So we want to make sure that you're doing it in the standard way that the field accepts communication and delivers information, and that's APA. Because, as I've mentioned, social work is a communication-oriented profession, you'll be required to write competently. So if you're having trouble that goes beyond APA, sentence structure, grammar, having difficulties organizing ideas and topics in a paragraph, it's important that you don't just push through it and submit the paper, but that you do actually seek out some of the resources we've got. So Dr. Lizzie Finnegan is available to help tutor students, and I really recommend that you use her as early and often as you need to. Papers that have multiple errors that just make it too difficult for me to read, they'll be returned to you. So you'll be expected to then make an appointment with her and rewrite them, and you'll have a late penalty. So don't put yourself through that. Don't put me through that. Just make sure that if you have any question about your writing aptitude, that you don't think of it as some sort of badge of honor, and that you go and seek some of the help that we've got there. People that are in faculty, people that are in graduate schools, and professionals always use other folks to help us edit our work. It's really important, and we need to have you do it too. What this also means is you don't want to be waiting to the last minute for these papers, so really pay attention to the due dates. You'll find Dr. Finnegan's contact information in the syllabus, as well as more specifics about this. Let's talk a little bit about the course assignments, because I'm sure that you're curious about those. And when you look in the syllabus, you'll see many more details about this. Please pay attention to those details. They are very important. In general, what I'll tell you is that we have 4 assignments. The first assignment is an analysis of a state mental health system, not New York. We're going to ask you to take one of the other 49 states and do analysis of the mental health system. And what you're going to do is you're going to analyze the capacity that the state has at its disposal to provide services to its behavioral health care clients. This will take the form of a 2-part assignment that culminates in a 10 to 12-page paper. The assignment is to be carried out in groups of 2 to 3 students, so you need to convene these by the first week, end of the first week of classes, or beginning of the second week. That's giving you a little extra time because this is going to be going up a little bit later than today. So you need to take 2 or 3 people and create a group, and you're going to sign up through the link in the assignment tab at the UB Learn site. This is going to culminate in a 10 to 12 page paper and is going to be 30 points towards your final grade. In the first part of this assignment, you're going to do an analysis, as I said, of the state mental health agency. And then the second part, you're going to, having made the analysis, propose some ways that we could make the system better. The goal of social work and policy analysis is ultimately to refine and create policies and implementations that make things better. So you're going to be doing two pieces there: the analysis and then the recommendations to make things better. So the second assignment, that first assignment I should mention, is due on November 19th. So it's a little later in the semester, but that's because a couple of the assignments are ongoing through, and also because I really want you to take some time to do some good solid analysis of the particular state in question that you're doing. The second assignment is going to be going on throughout the semester. When you go into your UB Learns class, you'll see that we have discussion questions, and each week we're going to have a discussion question posting and responses. You will be asked to take 2 weeks, pick 2 weeks, and then what you will do is you will post a thoughtful reflection upon the reading and some of the questions that a particular reading or readings may have brought up for you. Please don't make this more than 2 to 3 paragraphs. And when you do it, make sure that you have some questions there, because the rest of your classmates are going to then be responding to those. So if it's your week, you have 2 to 3 paragraphs where you create the questions, you summarize a piece in the reading that you thought was interesting, and then you sit back and let the rest of the class do the work. If it's not your week, you have a lot of work to do nonetheless. What you are going to do is you're going to be posting some discussion, some thought, some answer or response to each of the 2 questions each week. The way that you sign up for those is you log into UB Learns and you pick a week or 2 weeks. You cannot pick 2 consecutive weeks, and whoever logs in first gets first choice. So if you do want to pick today, when you get to this video, when you get to this assignment, go to it. By the end of this week, beginning of next, I want all of those filled out and want to make sure that each of you has picked 2. And you should be able to do that just by starting a discussion saying, I will be addressing this topic. And then, of course, you can revise it when you actually do the topic. The points towards your final grade is going to be 25. 2 questions are going to be 5 points each, and then your responses are 1 point per topic. Okay, so the more you respond, the more points you get. The third assignment is another one that doesn't have a specific due date for the whole class. You'll need to let me know directly what your due date is. This assignment is going to be an agency in service. It's to be determined with your field educator or your employer, and it's going to be a length that's also determined with your field educator and employer. This will count towards 15 points of your grade. What you are going to do is perform an in-service training at your field placement or place of employment, where you'll share one of the discussion questions with the agencies and the staff. So what you'll do is you will be facilitating a discussion or creating a PowerPoint presentation with your agency using one of the discussion questions and the discussion that you have done in the bulletin boards. So it will hopefully give you a nice synergy of people that are looking at this academically and people that are working in the trenches and actually may have some different thoughts or experiences to bring to it. You have to figure out exactly when you're going to do this, and your supervisor or field employer needs to send me an email themselves telling me what the date is and when you've completed it. Last but not least is assignment number 4, which is going to be your mental health policy analysis. That is due on the last week of classes. The due date is December 10th, 2018. It's going to be a 10 to 12 page paper, again, APA format. And in this paper, you're going to explore a particular policy of your own choosing. The reasons for the policy, the services that resulted in it, and the evaluation of this policy with its respect to its effectiveness. So again, You're going to take a look at something that's important to you, maybe that you already think of, or something that comes up in the readings, and you're going to analyze the policy. That will be your last assignment. That will also count to 30 points towards the grade. So to sum up, you have a state mental health system analysis for 30 points. You have a discussion, questions, and responses for 25 points. You have the agency in-service for 15 points. And you've got mental health policy paper for 30 points, which bring you to a grand total of 100. Now, although A's are really not the most important thing when you're dealing with a patient, I've never in my years of clinical social work or working in macro social work had anybody ask me what my grade point average was in school. I know that can be an important metric for many of you. What I want you to consider is the importance of this class is ultimately the ability to analyze policy and implement changes and interventions that improve the access for everyone, regardless of ability, to basic human rights and basic human needs in terms of our particular society. So, can children access the curriculum? Does play on a playground become available to everyone? Do people as they age get the same access to food, nutrition, culture? And across the lifespan, are we implementing policies that make more of us able to do more, or restrict more of us on the basis of one or more visible or invisible disabilities? So this has just been a beginning introduction, a hello. Each week you'll be looking at a lecture, a presentation and a lecture that's been narrated and designed by Robert Keefe, another professor of this course. And what I want to do is really invite you to, on Thursdays from 1 to 2, and I'll even be able to stay a little later than 2, come to the office hours so that we can all have a discussion together, so that we can talk about some of the readings and what you thought about them, questions you might have had, so that it doesn't necessarily just end up being the discussion board, but that you can engage with me directly. So again, mark your calendars. That's Thursdays 1 to 2. And our first one will not be this week, but will be next week. In the meantime, if you have any questions, feel free to reach out. The quickest way to get a response from me is to email. And again, that's malanglo@buffalo.edu. Thank you very much for listening, and I look forward to meeting you through the class. Have a good day. Bye.